My name is Corey Holdham, and I'm from the University of Queensland. Changes in extracellular matrix factors are a relatively new and understudied area of ALS research. Prior studies have shown collagens, an enzyme such as the matrix metalloproteases, to be altered in the disease. Similarly, hyaluronan, a major constituent of the ECM, has been shown to be decreased in the skin and serum of fasted patients with ALS. We measured the utility of venous hyaluronan as a biomarker for ALS in patients after a weight-adjusted meal, and compared the production of venous hyaluronan to healthy controls. 65 individuals with ALS were enrolled in the study. 3 patients were excluded due to a diagnosis of diabetes. 59 controls were also included as a convenient sample of patients' friends and family. The participants fasted overnight and were provided a body weight adjusted meal during the research session, consisting of pre-made chocolate sausagen. Throughout the session, participants were sedentary and a venous blood sample was collected 1 hour after the meal. Hyaluronan was quantified in plasma using a sandwich ELISA kit. We found decreased levels of venous hyaluronan in our ALS cohort compared to the controls. Our control cohort was younger than our patient cohort with a high proportion of females. Within the ALS population, there was no difference in circulating hyaluronan between patients with a spinal or bulbar onset disease. Furthermore, within the patient cohort, hyaluronan was correlated with age and ALS-FRSR, as well as being correlated with the individual's delta FRS. The association with age was not seen within the control cohort, and there was no association between hyaluronan and sex. As hyaluronan was correlated with delta FRS, we modeled patient survival using Cox regressions with sex, age, delta FRS, and hyaluronan and their interaction terms as predictors. An AIC-based stepwise procedure was used to reduce terms. Ultimately, we found a predictive utility for hyaluronan, age, and delta FRS. A test of the G-Row family found delta FRS to be predictive for patient survival. However, this was not reflected in venous hyaluronan measures. These data show that venous hyaluronan may have clinical relevance as an objective measure for functional capacity in predicting which individuals are going to be rapidly progressing. Our data are of fed measures of hyaluronan, which may not reflect measures of a fasted state and may be related to why our controls did not have an association with age, as was previously shown in literature. Further explorations into venous hyaluronan as a biomarker for ALS should determine its longitudinal stability within individuals, as well as validate its use as a functional biomarker alongside direct measures of physical activity. I wish to thank all of our funding partners, as well as the patients and control participants who participated in the study.